In this podcast episode, Dr. Suzanne O'Sullivan, a seasoned physician with over 3 decades of experience, discusses the complexities of modern medicine, particularly the issues surrounding overdiagnosis and the medicalization of human experiences. Her insights, drawn from her new book, challenge the prevailing notions of diagnosis and treatment, urging both patients and healthcare professionals to reconsider the implications of labeling individuals with various conditions. Dr. O'Sullivan begins by addressing the growing concern of overdiagnosis in medicine. While acknowledging that there was a historical tendency to underdiagnose conditions like autism and ADHD, she warns that the pendulum may have swung too far in the opposite direction. The current statistics indicate that 1 in 5 people in the UK is diagnosed with a mental health disorder, prompting questions about whether society is genuinely becoming unhappier or if we are simply medicalizing normal human emotions and struggles. She emphasizes that overdiagnosis does not imply that individuals are fine or that their struggles are invalid. Instead, it raises critical questions about whether labeling these struggles as medical conditions is beneficial. Dr. O'Sullivan expresses concern that many individuals may be receiving unnecessary treatments that do not address the root of their issues, suggesting that social support and changes in environment might be more effective. The conversation delves into the profound effects that medical labels can have on individuals, particularly children. Dr. O'Sullivan shares a poignant story about a patient named Abigail, who was diagnosed with a rare genetic condition after years of unexplained health issues. While the diagnosis provided clarity, it also transformed Abigail's perception of herself, leading her to internalize a label that could have limited her potential. Dr. O'Sullivan argues that labels can create self-fulfilling prophecies, where individuals begin to see themselves through the lens of their diagnosis, potentially hindering their growth and recovery. She contrasts this with the story of Valentina, a woman faced with the possibility of Huntington's disease due to her mother's diagnosis. Valentina chose not to undergo genetic testing, understanding that living with the hope of a negative result was more empowering than the certainty of a positive diagnosis. This highlights the importance of considering the psychological impact of labels and the potential for individuals to thrive without being defined by their conditions. Dr. O'Sullivan emphasizes the need for a return to generalist medicine, where healthcare providers take a holistic view of patients rather than focusing solely on specific diagnoses. She critiques the trend of hyperspecialization in medicine, which can lead to fragmented care and a lack of understanding of the patient as a whole. By prioritizing generalist approaches, doctors can better address the interconnectedness of various health issues and provide more comprehensive care. She also discusses the importance of listening to patients and understanding their unique experiences. In a healthcare system that often prioritizes quick diagnoses and treatments, Dr. O'Sullivan advocates for a more compassionate approach that values the patient's narrative and fosters a sense of agency in their health journey. The conversation shifts to the topic of cancer screening, where Dr. O'Sullivan highlights the paradox of early detection. While screening can save lives, it can also lead to unnecessary treatments and anxiety for individuals diagnosed with conditions that may never progress to serious illness. She cites the example of prostate cancer screening, where many men are treated for cancer that would not have affected their lives, raising ethical questions about the balance between prevention and over-medicalization. Dr. O'Sullivan urges caution in the expansion of screening programs, advocating for a more nuanced understanding of risk and the potential consequences of labeling individuals as at risk. She emphasizes the need for informed discussions between patients and healthcare providers, allowing individuals to make choices that align with their values and circumstances. Throughout the discussion, Dr. O'Sullivan underscores the psychological implications of receiving a diagnosis. She shares insights from her clinical practice, where she has observed that individuals who strongly identify with their illnesses often experience heightened symptoms and a diminished sense of self-efficacy. This phenomenon, known as engulfment, can lead to a cycle of dependency on medical labels and treatments, ultimately hindering recovery. She encourages both patients and healthcare professionals to consider the long-term effects of diagnosis on identity and self-perception. By fostering a culture that prioritizes recovery and resilience rather than solely focusing on illness, individuals can reclaim their agency and pursue healthier, more fulfilling lives.